So, I'm here with Dr. Nick Mills, University of Edinburgh, to answer some questions about the transport of ultrafine body particles within the body. Mm-hmm. So, where do ultrafine particles deposit in the body?
Well, ultrafine particles deposit with high efficiency throughout the respiratory tract. Deposition is largely dependent on aerodynamic diameter of particles. So ultrafine particles are able to penetrate deep within the airways and deposit in the bronchial airways and in the alveolar space with high efficiency.
And is there evidence that they can translocate once they are deposited?
This is a little more controversial, but over the last 10 years there have been a series of clinical and experimental studies designed to try and quantify this process. Now, in truth, the majority of particles are dealt with by the alveolar macrophage. They are cleared through mucociliary clearance pathways into the gut. Those particles that do evade the macrophage enter the interstitium and are cleared through the lymphatic system to the mediastinum. But increasingly, there is some evidence that there are pores or fenestrations in the, the air-blood barrier, and that ultrafine particles may be able to penetrate this. Now, I would say, if you try and summarize all of the research that's been done in a sentence, that the evidence to date suggests that less than 1% of inhaled ultrafine particles translocate into the circulation. Once they get there, they're able to interact with circulating platelets, monocytes, and they can target areas of inflammation in the body and are probably cleared by and large through the endoreticular system.
But could have a systemic effect then?
They certainly could, although I think that's probably not the dominant explanation for some of the acute effects, particularly in the cardiovascular system, that have been described following exposure to ultrafine particles.
And did we just talk about this? What factors influence their deposition and translocation?
Well, so there are a number of factors. Now, clearly particle size is going to be important, and there is some evidence that there is a magnitude difference in terms of translocation from experimental studies of particles that are in the 10 to 20 nanometer range compared to those that are in 100 nanometer in diameter. But there are other factors that are undoubtedly important. Airways inflammation, oxidative stress in the airways, and the permeability of the endothelium are two key factors that will increase the potential for particle translocation into the circulation. So therefore, patients with inflammatory lung disease or patients with endothelial dysfunction due to atherosclerosis may be more susceptible to translocation.
Interesting. Thank you very much. It's been a pleasure.
Indeed.
I'm getting more confused as the day progresses.
You're learning lots.